First at 6 tonight, it's a crime and a problem that we report on far too often. A former nurse at a Colorado hospital has been charged with stealing powerful painkillers intended to help patients.
CBS 4 investigator Brian Moss, who's in court for this one, joins us right now with the latest developments. Brian?
Authorities actually say this nurse was caught last year. However, she worked at a hospital in Greeley and was just charged this week.
Registered nurse Marlene Gilmore arrived at federal court to face one federal count of obtaining a controlled substance by deceit. Her lawyer, David Miller.
Well, she doesn't really want to say anything, she doesn't want to speak.
But in state documents, the case is laid out against the 28-year-old nurse. She worked at North Colorado Medical Center, which suspected last year Gilmore was diverting fentanyl and morphine intended for patients. An audit suggested Gilmore had stolen drugs 143 times in a 3-month period. When the hospital had her take a drug test, it came back positive for fentanyl and another opioid. Gilmore resigned the next day.
Just to make sure you understand, she's been proactive in terms of public health concerns were first for her, and then her family and their well-being was second. So putting the public health first was her main concern with this.
State documents indicate Gilmore entered drug treatment last year. Her attorney says he sees many young people getting hooked on drugs.
And then it builds upon itself, and then it's out of control. It's really sad. There's a lot of real sad things happening right now with heroin, fentanyl.
Gilmore's free on bond. If convicted, she faces a maximum of 4 years in prison and a $250,000 fine. Now, the parent company of North Colorado Medical Center is Banner Health. They say that patients were not harmed or exposed to any infection as a result of what happened at the hospital.
All right, thanks, Brian.
Yep.